The Pari PEP is an oscillating positive expiratory pressure device which provides the combination of positive expiratory pressure with oscillations to assist with chronic sputum retention and lung ventilation. It is generally prescribed to people over the age of 8 with chronic suppurative lung disease who have maintained a moderate to high level of lung function. It should be prescribed by a healthcare professional trained in the use of this device. This pipe-shaped handheld device consists of a mouthpiece and stem, a funnel-shaped cone, a steel ball, and a perforated cover. Assemble by placing the funnel into the stem, place the ball into the funnel and screw on the perforated cover. When the patient breathes through the device, the steel ball vibrates within the cone, providing oscillations within the chest, the frequency of which is dependent on the angle of the mouthpiece. If bronchodilators have been prescribed, administer them before commencing treatment with this device. Sit with a neutral lumbar spine with the elbows resting on a table and the shoulders and neck relaxed. Place the device into the mouth with the stem parallel to the floor. Inspire slowly to a volume slightly greater than tidal volume and hold the breath for 2 to 3 seconds. The breath can be inspired through the nose or, if necessary, the mouth if the lips are taken off the mouthpiece. Following the breath hold, place the lips firmly around the mouthpiece and breathe out actively, but not forcefully, at a slightly faster rate than normal. Vibrations should ideally be felt in the lower chest and abdomen. This feedback is used to adapt the technique. It may be necessary to stabilise the cheeks with the free hand to prevent the oscillations occurring in the cheeks rather than the chest. For subsequent breaths, it may be necessary to move the stem of the device slightly up or down until the full effects of the vibrations are felt within the chest. This is repeated consecutively for 5 to 10 breaths, depending on the individual's sputum volume, fatigue, and dyspnea levels. Suppress the cough if possible. This is called one cycle. After each cycle, relax and breathe quietly. The total number of cycles may range from 6 to 12, 2 or more times per day, which will vary according to the clinical status of the patient. Either at the end of each cycle or at the completion of all of the cycles, huff as instructed by the physiotherapist. This will depend on the amount of sputum in the lungs. For patients with unstable peripheral airways, huffing through the device may be very effective. To clean the device after every session, disassemble the components and wash in warm soapy water. Rinse thoroughly and leave to dry before reassembling. At least once a week, the device should be thoroughly cleaned as per the manufacturer's instruction booklet. At the end of the teaching session, the patient should be given written instructions explaining the technique, the prescription, and the cleaning of the device.